Ready? I'm going to call the Shawnee County Board of Health meeting to order. Welcome. And I'm going to turn it over to Alejos at this point.
Good morning. Allison Alejos. I'm the director of the Shawnee County Health Agency, the local health department. I am pleased to be here today. We have a very busy agenda, lots of items on here, some good information that will hopefully help to inform you all so that you can understand better some of the trends in our community and things we've been working on, some of the things that that tie back to our community health improvement plan you'll be hearing more about. So I'm very excited with the agenda we've got today. So with that, I'm going to go ahead and I'm going to turn this over to Dr. Pizzino, the Shawnee County Health Officer. He is going to speak with us about vaccines, the importance of immunizations, and the effectiveness. So with that.
Good morning.
Good morning. Good morning.
Members of the Board of Health and commissioners. I always like to remind you that you wear two hats in these meetings. I'm Gianfranco Pizzino, you're our local health officer, and I'm going to spend a few minutes talking about immunizations. It's a topic very dear for me, starting from the days back then, a few decades ago, when I was working in Africa, and I had the opportunity to witness firsthand the devastation that some of these diseases can cause, and for which most people have no idea right now because of the effect of vaccination. So the first question I want to address is, are vaccines effective? And I'm going to show you a couple of charts to give you a sense of that effectiveness. These are the number of cases reported. Now, reported is a key word. Reporting is not perfect. So these are the cases detected by the public health system, but especially back in the 50s, in the 60s, only a fraction of those cases were reported to the system. But even just looking at the reported cases, if you look when the vaccine was introduced in the mid-60s, look at the drop in the number of cases. It is just amazing. There is no doubt that that vaccine really stopped the transmission of measles. The last case of measles in our community was, I believe, in 1992. It's a disease that medical students now have a hard time diagnosing because they've never seen it. It's similar but somewhat different in some aspects. Story for pertussis or whooping cough. Very serious disease, especially newborn babies who are too young to be vaccinated, and you can imagine how tiny their air pipe is, and when they get this disease, often they stop breathing and they may die just by suffocation. The vaccine was introduced pretty early. It really got more popular in the early 50s. And you can see that the disease went down, so similar story as with measles. However, then it went back up, and you can better see that in this little insert. And the reason is that we learned later on that the vaccine immunity is not as long and prolonged as we originally thought. So in a way, it's not a demonstration of what happens when you have a vaccine that works, and then what happens when either the vaccine doesn't work, or you could probably see the same picture if all of a sudden a lot of children were stopping to get their vaccine, were prevented from getting their vaccine. That's what you will see. So when we drop our guard, or when the vaccine for any reason does not protect anymore, the disease goes back up. So even though these diseases are almost absent from our communities, it doesn't mean they're gone. They're still there. The reason we don't see them is because of vaccination. Chicken pox, often considered a mild disease, and in most cases it is a mild disease. However, usually before the vaccine was introduced, over 100 people every year would die, mostly children, from chicken pox in the United States. And you can see that the higher the vaccination rate in the country, and the lower the number of deaths. This number of cases, again, these numbers are not terribly reliable. Chicken pox was not even a reportable condition until after the vaccine was introduced. But it's pretty clear that the transmission for that disease was interrupted fairly effectively with the introduction of the vaccine. This is one of my favorite slides. This is called Haemophilus influenza type B meningitis. It's when people in my generation, when we talked about bacterial meningitis in children, that's what we meant. We didn't have to specify because it was so common. That was the prevailing bacterial meningitis in kids. Once again, today we can't train medical students to recognize this disease. It's all but disappeared. This is one of the most amazing. Oh, the vaccine was introduced in 85 or 86, by the way, when you start seeing the drop. So these are all good success stories. Now, we hear a lot about vaccine safety. Are vaccines safe? The short answer can't be just a yes or no. Vaccines are pharmaceutical products. Like any other pharmaceutical product, they have some contraindications. They must be administered by qualified healthcare providers, and they may have some side effects in some cases. But overall, the safety profile of today's vaccines is extremely high, to the point that even in the mainstream media now, it's recognized that vaccines are safe, and there was a time when media liked to ride over the controversy of, are they safe, they're not safe. They were very prominent and loud public figures that were speaking against vaccination. But this is what you see these days on CNN, for example. There is no doubt in my mind that if vaccines are administered in a proper way, their safety profile is very high. All my kids have been vaccinated, and I've been vaccinated myself. I still get my vaccines every year for the flu and so on. How are we doing in Shawnee County? I wish I could have better news for you. Kansas as a state, to begin with, traditionally has not done very well compared to other states in terms of getting our children vaccinated. To be more precise, I don't have the chart here, but if you look at the chart of coverage rates for children in Kansas over time, it goes like this. And what that means is that under ordinary circumstances, if everything goes well, if there is enough vaccine, if there are no major crises, if the media work with us, and if the education reaches the parents, we can do a decent job in the state. However, any kind of a challenge in all those areas that I mentioned, and typically in the last few years, sometimes there is a shortage of some vaccines, will make our rates drop. So in the last national statistics, we are, depending on which vaccine you look at, certainly in the bottom 10 in the country, and sometime in the bottom 2 or 3. Within Kansas, Shawnee County has usually one of the 5 lowest coverage rates in the state. To be fair, the other low coverage rates are in the other urban counties. So it's nothing wrong with our health department. It's just the challenge of immunizing an inner city population, in some cases like the population that we have in our county. So all that to introduce this chart. This is children fully immunized by the age of 2. And you can see that our value is 45.6 compared to 61.5 in the state. So we are doing worse than the average in the state, but even at the state level, we are doing pretty badly, I would say. So that's really not a good picture, and we want to change that. We do a little bit better than the state when it comes to influenza vaccination among adults. But again, the baseline that we have for the state is so poor that there is nothing to be proud of here. More than a third of adults in Kansas are not immunized. When I say adults, I mean adults over 65 are not immunized against influenza every year. And we are a little bit barely above the number, 69.9%. You're probably aware that there are requirements for school admission in Kansas. These are set by the legislature and the Kansas Department of Health and Environment through statutes and regulation. This is the list of vaccines. I'm not going to read that. It's probably not terribly interesting for you, but just to give you an idea that there are specific requirements for school admission, and then there are some that also apply to child care. Then there are some recommended but not required vaccinations. And those are the vaccinations for which the coverage rate usually drops, because it's been well established by research that when there is a requirement for school admission, kids get immunized. And when there is not the requirement, they get immunized less often. So that's what's happening here with human papilloma virus, which is one of the best prevention for cervical cancer. meningococcal, and influenza. You will hear more about some of these in the following presentations. There are some exceptions for those requirements. Kids can be admitted into school without a vaccination if they have a medical contraindication or if they have a religious exemption. They are adherent of a religious denomination whose teachings are opposed to such tests or inoculations. The law is very vague about that, so it really doesn't require any proof, so to speak. It doesn't even require to state what those beliefs are. It's just a plain statement that we belong to a congregation that oppose those inoculations. Kansas, unlike a few other states, you may have heard recently in the news about Oregon and California, we do not have what usually is called a philosophical exemption, which essentially means, as a parent, I just refuse to vaccinate my children because I don't like it. That's a philosophical exemption. We do not have that in Kansas. They have that in California. They have a huge outbreak of measles as a result of one case that visited one of their entertainment parks, and that mushroomed in hundreds of cases throughout the state. As a result, the legislature now reversed that course, and they made those exemptions much harder. I think they actually moved away altogether from the philosophical exemptions. But all states have a religious exemption. Have medical exemptions, and most states have a religious exemptions, and we do as well. What is my role in all this? And indirectly, what is your role, since you appoint me? And so I report to you when I make these decisions. The health officer in Kansas has the authority to exclude children from school if they are sick with a vaccine-preventable disease, which is contagious, of course, and also to exclude the close contacts of a sick child if those contacts are not protected by vaccination. So the typical situation would be, let's say, in a child care situation where a child comes down with pertussis. Everyone who is in that daycare who is not already vaccinated will have to be excluded for 21 days. Usually it's 21 days, depends on the type of disease. What the health officer does not have the authority to do is to exclude unvaccinated children when there is no case of disease. That authority is only on the school board of health or superintendent. Personally, I think that's a weakness in our protection system. It's almost like closing the doors of the barn after the horses have run away. Once you have the outbreak, then you say, yeah, you stay home. Well, it's a little too late. Now you already have a bunch of kids who probably are already infected and will come down with the disease. But that's what the law says, and we have no authority to change that at the county level. Just looking ahead at the future, what we are trying to do is to do the services and we'll say we as a health agency, to do the services that the health agency is best positioned to do, which is primarily the community level, and to try to minimize the role in just giving the shots. Shots can be given by providers. There is a variety now also by pharmacists, depending on what vaccines we are talking about. But providers won't go into a school, for example, to do a school campaign. They will not do the type of community broad education and information campaign that the health agency can do. So we are trying to do less duplication and more outreach of services. And we are also trying to prepare a response in case we have a possible pandemic, which means a very broad outbreak that will cover essentially the entire world. Influenza is the most likely agent that would cause that. If that happens, it's going to be a game changer, and there are specific laws that probably would be put in place and give the health officers also more authority than we have right now. And we also try to work in very close connection with private providers so that we don't duplicate services. Again, I don't have the numbers. My understanding is that the number of immunizations for influenza that the health agency has given in the last few years has decreased, while the number that was given by private providers has increased. I think that's the right direction. That's what we should do. Let providers do what they're best at doing, which is one-on-one encounters with patients who can afford to see that provider, of course, and let's do the things that we are best positioned to do, because the providers just don't have the tools and the means and the knowledge and the skills to do that. You're going to hear now, I think, from some other staff about some specific activities on immunizations the health agency has. Any questions that you have at this point for me?
Questions for Dr. Pizzino?
Yeah, Mr. Chair, thank you. A couple of man-on-the-street observations. Number one, it seems that vaccines are continuing to advance. For example, several years ago, I got a pneumonia shot, and my doctor says there's a new and better pneumonia shot now to get. A year or two ago, I got a shingles vaccination. So it seems like the vaccines are progressing and advancing year after year. Is that your thoughts also in the health business?
Yeah, no, that's definitely the case. Some of you may remember the huge discussion about mercury in vaccine that took place about 10 or 15 years ago, and what that was, it was a very small amount of mercury that was used as a preservative in multi-dose vials of vaccines that are typically used like in the health department when you just open one vial and then you use it over a period of a day or two with multiple children. Even though there was no proof that the mercury was harmful, it was decided just as an abundance of precaution to remove the mercury altogether. So today, no vaccine sold in the United States has mercury as a preservative. Just to give you an example, as you say, sometimes there are new vaccines that are introduced that may cover the same disease of an existing vaccine that just better and improve. We just had a new vaccine introduced for a specific type of meningitis group B, which up until recently was not a disease that was vaccine preventable, and now it is. There is a lot of investment in research. There could probably be more. There is a lot of economic factors you can imagine that play a role. Developing and having a new vaccine approved in the United States is a huge task. And so that's done usually only for diseases that are quite prevalent and for which there is a market in developed countries. Unfortunately, there are diseases in other countries such as malaria, tuberculosis, that kill many more people, but not here, and so there wouldn't be a huge market, and guess what? We have no vaccines for that. I'm digressing. That's not really immediately affecting Shawnee County, but yes, there is a lot of new vaccines being developed.
And if I may, Mr. Chair, the other thing I wanted to point out is that there are just a lot of players in the immunization business now. CVS and Walgreens. Last year when I got flu shot, it was at Sam's Club. And I think we need to make sure that
Airports. I travel quite a bit. I mean, I could get five flu
Really?
shots in a month if I
heard
wanted.
that one. But I guess the point is, that I think that's very important as we're doing our strategic planning and staffing and looking at the future of our health agency in Shawnee County.
I agree, and that's
all
part
right.
of the coordination and outreach that I was mentioning. I think you can expect in the next years or decade. I mean, it takes time, of course, to have
Right.
that kind of transition. But the more some of this direct provision of service can be moved out to other providers, the more time and resources we can invest in doing the other things that only we can do.
Very good. Thank you, Doctor, and thank you, Mr. Chair.
Thank you. Any other questions? Thank you, Doctor.
Thank you.
One thing I'd like to state, just to follow up with Dr. Pizzino and your comments, Commissioner Archer, as far as strategic changes in our immunization program, we do that routinely. As an example, the flu shots, we used to be a major contributor, one that would provide flu shots in the community, and the doses we ordered every year were very, very high. We are down now to probably about 1,200 doses that we order a year through a private supplier to give those folks that have private insurance. They're not Medicaid eligible. And that is something that we offer through our community health center as well as the local health department. And you're going to hear from Linda in just a minute about some of the things that we're doing in our community to try, one, to increase vaccination rates, but also to respond to those changing needs and trends.
But that's down from, what, 8,000 or 10,000 historically? Is that-
Yeah, correct.
Linda, is that about
correct,
right?
Correct.
Okay.
So with that, I'm going to go ahead and introduce Linda Oakes. She is provides oversight to one of the programs related to immunizations, and I'll turn it over.
Morning, Linda.
Good morning, Commissioners. I'm going to talk about several things today, but the first topic I'm going to talk about is HPV, or the human papillomavirus, and Dr. Pizzino did mention that. That is one of the vaccines that we have. First of all, about the infection a little bit. HPV is the most common sexually transmitted infection. Most people never know they've been infected unless a woman has an abnormal pap test with a positive HPV test. Most HPV infections happen during the teen and college years. Wrong button. Here we go. Persistent HPV infection can cause cancer in both men and women. HPV infection can cause cervical, vaginal, and vulvar cancers in women and penile cancer in men. HPV can also cause anal cancer, mouth-throat cancer, and genital warts in both men and women. Nearly 18,000 women in the United States are diagnosed with a cancer caused by HPV each year. There are more than 9,000 HPV cancers diagnosed in U.S. men each year. And as it says, that's one case every 20 minutes. Cervical cancer was once the leading cause of cancer death for women in the United States. Now it is the most preventable of all female cancers. The Pap test has helped decrease the number of women in the U.S. with cervical cancer by about 75% in the past 50 years. However, even with an excellent cervical cancer screening program in the U.S., there are still over 11,000 cases of cervical cancer each year in this country. And most people think of gynecological cancers as just affecting older women, but cervical cancer affects 1 in 3 women who are of reproductive age. So there is a vaccine for HPV. It became available in the United States in 2006. It's a series of 3 vaccinations given over a 6-month period. It was first recommended for girls, but boys were added to the recommendations in 2011. And it's recommended that this vaccine is given to both boys and girls ages 11 to 12 years, and the series should be completed by their 13th birthday. It's a safe vaccine. It's been tested. It was licensed in European and Australian countries before us, so it's been very well tested. It works, and the efficacy lasts a long time. There are some side effects. The most common side effects are pain, swelling, and redness in the arm where the shot was given, which is pretty common with most shots. And so we have this great vaccine that can prevent cancer, not just HPV, but the HPV cancers. So a lot of people are getting it, right? No. This shows you in the United States our rate, and that girls, again, this is what the studies have been done with girls because of the long time of the licensure, is only 33.4% for the 3-dose coverage. And that compares to the United Kingdom that has a 60% and Australia with a 71%. So again, very low rates of vaccination with this particular vaccine. And it's interesting, I heard a presentation by Dr. Wharton from the CDC on this, and she said usually with vaccines we have the introduction and we see a low rate and then it spikes. We have not seen this with this vaccine in the United States. So what about Kansas? How are we doing here in Kansas? We have the lowest HPV vaccination rate in the country. There we are, bright yellow, right in the middle. So for 1 dose of vaccine, 1 or more, our rate is 39.9%. For all 3 doses in Kansas, the rate is 17.2%. And for when you put both boys and girls together, the rate is 12.8%. So very, very low. So what are we going to do about this rate here in Shawnee County and in Kansas? Well, in Kansas, the Kansas Foundation for Medical Care has started a campaign, and you've got a copy of this postcard in your packet. This was a card that was sent to parents with children who are the age that need to get this vaccine. So that's a statewide push. In Shawnee County, we are really stressing the vaccine at every visit. We're doing a lot of education about how to present the vaccine. This is a cancer preventable vaccine. We talk about cancer with this vaccine. We're sending out reminder postcards and letters, and we're also starting some school-based clinics this year. We're going to offer some clinics in at least 1 district in the county in 6th grade. We'll offer the Tdap, the meningococcal, and the HPV vaccine, and then we'll go back and do the other 2 HPV vaccines. I think this is a great convenience for parents for us to do this in the school. These kids will all be ready for 7th grade and they'll get these vaccines. So that's all I have about HPV. I'd be happy to answer any questions about that or the vaccine.
Any questions for Linda regarding this? Commissioner Mueller.
Yes. So once you're past that window, then you are not eligible to get that vaccine anymore, or how does that work?
Actually,
If
that
you get-
vaccine is licensed up to age 25, I believe, or 26, and we do encourage the older teens to go ahead and get it. So they want to vaccinate the 11 and 12-year-olds because their immune response is the strongest at that age, and also we want to get it to them before they're sexually active. So, but
recommend it before
yes,
age
when we recommend it to
25,
any teen, young adult that comes in the health department, and I'm sure that providers in the community do also.
Good.
Just quickly, it's sort of a politically sensitive area from what I recall. Is the immunization, is that covered by most private health insurance companies?
Yes, it
Is
is.
it?
Yes,
And I
it is.
think that's a good thing
It is
to
covered. It's
let people know.
It's an American Council on Immunization Practices recommended vaccine, so it is covered by insurance.
Good, thank you, Mr. Chair.
Thank you. No, I have no questions.
Okay.
Thank you.
Couple more short things. It is back to school immunization time. It's summer. We're starting to get a little busier. So I just wanted to encourage parents to get your children in now. If you wait till the first week of August, it'll be a little bit of a wait. So encourage people to come in now. We will have some extra vaccinators and extra systems set up right before school starts. And also to remind parents that children under 18 must be accompanied by an adult, a guardian or parent. If you send an older sibling or another adult, please send a note that gives permission to do the vaccinations. The last thing I want to talk about is we are going to have a presentation in partnership with the Topeka and Shawnee County Library of this Nova film, Vaccines Calling the Shots. It's an excellent presentation. It's about a 60-minute video that talks about the importance of vaccines, how they work, why it's important, and I did want to show you the trailer. Let's see if I can do this. Do I have to go down here, Allison, you said? Okay, I can't see the mouse is kind of... there we go, thank you. All right, and then it just is really kind of touchy, yes, thank you.
Connected in 1,000 unseen
I don't want to
ways.
sit full
But
screen.
sometimes
Can you help
these
me?
connections can pose an invisible threat.
You don't have to cough, you just have to breathe. It's the worst kind of contagion. It's airborne.
Old diseases are returning as nervous parents skip or delay their children's shots. Brooklyn, a measles outbreak begins.
It's like telling me, look, we found smallpox. No one sees measles. Who sees measles? This is New York.
58 are infected, including 2 pregnant women, one of whom miscarries. All were unvaccinated at the time of infection.
If we didn't have the high vaccination levels in New York City, we would have had hundreds, if not thousands, of cases.
And you know, as doctors, your job is to try and save children's lives. And when you stand helplessly by and watch them die, it gets to you.
More than 90% of Americans vaccinate, but in some areas, pockets of low vaccination form, often fueled by mistrust and fear. Alarming stories spread.
This beautiful girl is my daughter Jody. She's 16 and she has autism.
In 1998, an English doctor, Andrew Wakefield, claimed a link between autism and MMR, the measles, mumps, and rubella vaccine.
When I read that, I was taken aback. We have to look at this. Eventually that study was shown to be fraudulent and it was withdrawn.
Now, new research is revealing the genetic causes of autism and that it begins in the womb.
We don't know everything that causes autism, but all of the genetics is pointing to fetal origin.
I think we were right to look at whether vaccines might be a cause of autism, but there comes a point where there is so much evidence, none of which shows any link between vaccines and autism, that you have to say enough.
In a time where misinformation can spread so rapidly, it can be difficult to sort fact from fiction.
Nobody is willing to really have a conversation with you and discuss what's a severe reaction, is it okay to have a seizure?
I don't know who to ask. There's no such thing as an unbiased source.
We ask them to trust that we are recommending the best thing for their children. That's a big deal.
If the number of vaccinated people decreases just a small percentage, it can lead to an outbreak. At this critical moment, NOVA investigates the science of vaccines. How do they protect us from disease?
The less the disease exists in my circle or the next, the safer I am.
What are the real risks of vaccinating?
It's a balancing act. The risks happen to be minuscule. The benefits are enormous.
What are the consequences of opting out?
If you start to decrease vaccine immunization rates, you start to see the diseases reemerge.
On the front lines of medicine, what can be done to prevent more outbreaks?
It's not about saying, oh my gosh, I'm afraid, and now that's the end of the conversation. No, that's just the start of the conversation.
Vaccines. Calling the shots on Nova.
I can do it. No, that's not. Okay, thank you. So this is going to be presented at the, as I said, Topeka and Shawnee County Public Library on August 24th. It's a Monday evening at 6:30. And after the video, we're going to have a panel discussion, and the panelists are our own health officer, Dr. Pizzino. Technology. I love it when it works.
There we go.
Dr. Pizzino, Dr. Dennis Cooley, who's a well-respected pediatrician in our community, and Mr. Andy Marceau, who's a meningitis survivor and wrote the book Worth the Pain, Surviving Meningitis. Great book, if you ever get a chance to read it. He's a very talented young man. So these three are going to be there to answer people's questions. I think in the video they say, you know, there's no unbiased source. What is a serious reaction? What is a seizure serious? So I hope parents will come and ask those questions that they have, and we can have that dialogue and that conversation. There's lots of bad information out there, so we want to help get the good information out there. So August 24th, 6:30 at the library. And unless you have any other questions, that's all I have.
Do you have any questions?
No,
All right,
no,
thank you very much.
Thank you.
Thank you, Linda. Okay, so now we're going to turn it over to Diane Creek, and she's going to provide some updates to things that are going on in the Maternal and Child Health Division, specifically fetal infant mortality review.
Good morning, Commissioners.
Morning.
I'm Diane Creek with Maternal and Child Health, and I'm here to talk to you about fetal and infant mortality review program. The infant death rate in Shawnee County for the period of 2009 to 2013 was 6.8 infants per 1,000 births. And so infant death is defined as birth to 1 year of age. So that's what we're talking about. According to KDHE, the counties with the highest number of infant deaths in years 2009 to 2013 were Sedgwick, Johnson, Wyandotte, and Shawnee. So we're number 4. These 4 counties accounted for the 51.4% of all the infant deaths in Kansas. So we're number 4 on that list. And infant mortality is viewed as a sentinel event that serves as a measure of communities' general health status as well as the social and economic well-being. And so that's why we want to study it and see what's going on with the babies. And so what are we doing in Shawnee County? We started the Fetal and Infant Mortality Review Program, and it's an action-oriented community process that continually assesses, monitors, and works to improve service systems and community resources for the women, infants, and families. And I want to emphasize that it's a community process. It's not a health department process, it's community. So it takes the whole county to participate in this. And so FEMA's used for assessing and planning and improving monitoring service systems so that if there's a problem, if we abstract these cases and find out that there's a problem with transportation or health care, insurance, prenatal care, those kind of things that we can fix, then we work on that. So that is the whole reason for this program. So the opportunities are to monitor the effects of changeable healthcare systems. So as the healthcare system changes, we can monitor the effects of those on the pregnant women and their babies. And we can get more information than just a death certificate from Vital Statistics provides. We have abstractors that go into each of the hospitals and they look at the whole medical chart of that mom and that baby. They go to the coroner's office, they go to OB offices, pediatricians, wherever medical records are for the mom and the baby, and they abstract information out of that chart. And then we take it to a community or a case review team. And so the case review team is key members of the community were chosen. It has to be a fairly small group because we meet every other month and we discuss the cases. So there's a lot of confidentiality issues. We keep everything completely confidential. The cases that we take, the only people that know who the identity of the mom or the baby is myself and the MCH team leader, maternal and child health team leader. Case review team does not know the identity. The cases are de-identified when we take the cases to the CRT. And they sit there, they are a group of chosen people that are professionals in town. We've got hospital administration, we have OB doctors, we have pediatricians, social work, drug treatment, Dr. Pizzino's there, Dr. Cooley is there. We have a community member who participates who lost a baby to SIDS. So it's a good, diverse group of people. So we review and analyze the abstracted cases, and then we try to figure out causes of that infant's death. And then we come up with a list, and so at the end of that time, it'll probably take about a year to come up with a complete list of recommendations that will go to the community action team. And so far we've reviewed 3 cases. December's meeting was basically an orientation and to teach people what FEMR is about. And then February we did 2 cases. April we did 1 case that was very big. And so we'll come up with a list of recommendations and issues that are here in Shawnee County, and then we'll give those recommendations to the community action team that hasn't really started meeting yet. And the community action team will take those recommendations out into the community, try to make changes, you know, whether it's policies, whether it's services that we need to change, you know, whatever needs to be changed. So that's it in a nutshell. Do you have any questions?
Questions regarding the firm?
FEMR, that's okay.
Commissioner
What do you think will be some of the recommendations that we'll make?
It's
based on what you know now.
Right now,
Yeah.
it's hard to tell because this affects every single zip code in Shawnee County. It's not, when I first got into it, I thought maybe, you know, the zip codes that have more economic issues might be higher, but they're not. There's not, so right now we can't really point it to any one specific thing. There's some genetic issues that of course we're not going to be able to do anything about, but you know, there could be, I mean, the last one we did, there was a lot of just life things, social issues, and a lot of, I've seen some cases with no prenatal care, so things like that. And so I think those are things that we can do something about. I think we can either educate people more, you know, and depending on what the community action team comes up with, you know, as far as solutions. And the community action team is going to be, it's going to be comprised of community members. And so, you know, you guys might be asked if you're interested to be on that team. There may be business owners, there may be a lot of public people, obviously, you know, community members. so they can, you know, figure out exactly what to do about it.
If I may.
Yeah.
Wouldn't you assume a lot of fetal death is driven by drugs and alcohol abuse?
You would assume that, but that's not.
Is that not true?
That's not true either, because that was along the same
That's a headline
assumptions
for
that I
me
had.
then. That, yeah,
Right,
that would be
right.
what the man on the street
Right.
would think.
Exactly. That was the assumption I had, that, you know, drug abuse, you know, there may be a lot of poverty, lack of education. We've got all educational levels of moms who have lost babies. One thing that I would like to say is that, you know, in case somebody who has lost a baby is listening to this, if we contact them to do a maternal interview, because that's a critical piece of this whole process, but it's a tremendously hard thing to do for the mom, and we know that. We have a social worker that does it for us, does the interviews. And so if moms would agree to do the interview, totally confidential, they give so much information to us about what happened during that pregnancy, and their viewpoint on what happened during that pregnancy. And so that piece is really critical. And so we've had one mom agree to an interview so far. And so it's a really tough thing. It's a tough thing if you've lost a baby to do an interview. Yeah,
imagine.
yeah. So we're very, very respectful to her. So.
Thank you, Mr. Chair.
Thank you.
Appreciate it.
Dr. Pizzino.
Just a quick comment. The last case we reviewed, I'm on that panel, was the incident that was heartbreaking. I mean, when you read these stories and the experience of the mother that describes what it is like losing a baby, the thing that struck me was, just as you were saying, her perception of the assistance and the care she had received was different from the perception of the providers of that care. And in the end, I think through the discussion in the group, we came to the conclusion that the part that was really missing was a coordination, was somebody who could actually be the face that could speak for all the care providers and just be the face of the woman and make her feel like the system would actually care for her and her baby. And she kept saying, I have the impression nobody cares. I lost this baby, nobody cares. Nobody took care of me. But when we look at the list of interventions that have been put in place for the woman and her baby before the death, it was very long. So what was missing was a comprehensive, encompassing type of intervention and just a case manager, if you want to use a simple word. And so, you know, back to your question, what are the recommendations? I'm not going to tell you that's one of the recommendations, but that's an example out of one of the stories of something that could be done to prevent future events like that.
So a more integrated approach.
More integrated,
Right.
yes.
Okay.
Right.
Thank you again.
Thank you.
All right. Thank you.
And of course, I have to follow up on that just a little bit. I too am on that team that's reviewing those infant deaths, and it does take some time for us to get trends identified. We're really not pointing to a cause. Cause has already been established through autopsy or some other mechanism. We're looking for those trends in our communities that speak to improvements we can make. And so it will take us some time. Usually, I think they recommend a year to year and a half of reviewing cases before you come back with recommendations to move forward to a community action team. So with that, we'll continue to update you all as we move forward through this process. It's very beneficial work, and I think it's going to help us improve those infants' survivability in our community.
Right.
So with that, I'm going to go ahead and I'm going to turn this over to Tom Llewellyn from Stormontville Healthcare. He's going to come and talk to us about community health needs assessment. If you can believe it is time to do that again. So I'll turn that over now.
Good morning, Tom.
Good morning. As Alice said, I'm Tom Llewellyn, the Director of Planning at Stormontville. And I think it was 2 months ago, maybe 3 months ago, Allison was before this group with the Community Health Improvement Plan, that these various activities on healthier living, healthier eating, healthier babies, and, you know, improved access to health care. All that came out of a community health assessment that we did about 2 years ago, almost 3 years ago. Well, as you can see, round 2 is coming up. And what's happened is the Affordable Care Act required this of all not-for-profit hospitals, and they put in there in the legislation that we have to do this every 3 years. And it's interesting, the health departments have to do it every 5 years, but we're getting assistance from the health department on this. It's pretty general, broad guidelines on what we have to do, just define the community, identify the healthcare needs, the significant needs out there, and get interest from persons, representing a broad interest to the community. We did this 3 years ago, and the main participants were Shawnee County Health Agency, St. Francis Healthcare, and Stormont Vale Healthcare. Those three will be the key players again to put faces on that. We have Kathy Harris from St. Francis will be their representative, and Allison and myself. Like I said, we did this before, so we know what we're doing, and have a much better idea what we're going to do this time. And we have a brief timeline here of, data collection is happening right now. We hope to start analyzing and prioritizing all the information the last quarter of the year, and then, late winter or early spring, probably come before this board with our findings of this second round of the assessment. And that's my quick update. Any questions?
Questions?
Okay,
Thank
thank
you
you.
very much, Tom.
Tom's been a great partner. I've had the privilege to work with him from the very beginning as we went down this path, and both Stormont as well as St. Francis have been just great to work with, and I look forward to that continued work as we move forward on this one. Okay, so just to kind of talk about the next item here, we've got a presentation that's going to be coming from one of the groups at Heartland Healthy Neighborhoods, specifically the Complete Streets group. They have indicated that they have some information that they want to share with you all as the Board of Health. I think you'll find it informative and exciting, the things that are happening in Shawnee County. So with that, let me turn their presentation on. So then Emma Starkey and Andy Fry are going to come up, and they are going to present. Let's see.
So for ease of access, I've got some printouts for you as well. All right. I'm Emma Starkey.
I'm Andy Fry.
And we're here to represent Heartland Healthy Neighborhoods. To really kind of wrap your arms around what we're going to talk about today, it's going to be pretty straightforward, but we're going to take a second, stop what we're doing, and celebrate some of the successes that we've had in our community, which there's been a variety of successes we're here to talk to you about. So we're not asking you to do anything, but listen to us as we kind of be the cheerleader for the community. Okay, so I'm sure you're familiar with Heartland Healthy Neighborhoods, and I'm sure you're familiar with our little motto here. We have it on the back of our t-shirts. It's kind of something that we live by. Coming together is a beginning, keeping together is progress, and working together is success. So something we're going to talk about is our success, and as you can see, Heartland Healthy Neighborhoods is going to be mentioned here at the beginning of the slides, and then not again. So it's coming together is a success. It's the community partners that we have that are implementing these successes that we're talking about today. Okay, so Heartland Healthy Neighborhoods, give you a really quick overview one more time of what we are. We're a community mobilization coalition that takes action on health priorities with the goal of a culture shift towards health and wellness. Now that's something to keep in mind when we're going through our presentation today, is that all of the successes we're going to talk about are in the field of transportation, but all of these have inherent health benefits. Okay, so Complete Streets Work Group. I've been in front of you before to talk about our Complete Streets Work Group. The goal of this work group is to implement and improve on our complete streets in the community of Topeka and Shawnee County. So what is Complete Streets? Complete Streets is an effective complete street design that accommodates all users, modes, and all types to be defined as motorists, pedestrians, cyclists, motorcyclers, freight haulers, emergency managers, and residents of all ages. Basically, it is a policy change that implements the way we design our streets and our transportation network. Okay, so here's what a complete streets looks like. Look at that beautiful street. Does anyone know where that is if you can't see the text? It's 17th and McVicker. So Washburn has a really great example right now of what complete streets looks like. We've got our light poles, so we've got well accessible lit. We've got a beautiful little sidewalk. We've got, if you can see, there's a little sign that has a little pedestrian crossing. It's got a light on it, and there's a break in the middle of the street where pedestrians, if they can't get through across the street the whole way, they can stop in the middle of the street and wait for traffic and then go through again. Another good example of complete street, here is that exact walkway I was talking about, a break in the middle, if you can see there. So that's a nice thing to have. So now we're going to talk about one of the successes. So again, we don't have Heartland Healthy Neighborhoods on any of these slides because these are good things that are happening in the community from our partners. So the first one we have is the partner of Shawnee County Health Agency. And I know you all are familiar with the Safe Routes to School and the success of that, but it's one of those things to highlight, to say multiple times, to cheerlead to the community, because this is a big thing. So Safe Routes to School, it's unfortunate that Craig couldn't be here today, but he spearheaded the Safe Routes to School initiative with the Quincy School. So here's a little picture of the walkers. So to update the audience, the Safe Routes to School project actually physically took bodies and walked the streets and the sidewalks that the kids would be experiencing walking from their neighborhood to the Quincy Elementary School. So along the way, they took pictures of the barriers that the children might face, safety concerns, sidewalk issues, issues where there is no sidewalk, sidewalks are overgrown, all sorts of fun stuff. So along with that, sort of to piggyback on the success of the Quincy Street, or excuse me, the Safe Routes to School at Quincy, we've got the We the People project, which is a partnership through a variety of different people in the community. And the We the People project integrated arts from the Quincy School children into a safe walking path. So there were banners that hung along a safe walking path that connected the No-Toe Arts District with the Quincy Elementary School. So here's the banners that the kids created. All of the art on there are the Quincy school children's art. These banners also hang up in No-Toe right now. So it illustrates a really nice pathway between the Arts District and the Quincy Street, or the Quincy School. Here's the kiddos. Cool. Couple of the banners. Okay, so here's the kids actually walking the route. Cute, right? Okay, I'll turn it over to Andy.
I'm assuming most folks are probably familiar with the Bikeways Master Plan that's been going on for a couple of years, but for others that might not be, it was adopted in 2012 by the Metropolitan Topeka Planning Office. And as a part of that, they hired Topeka's multimodal planner in 2013. And then in 2014, they started putting up some of the signage that's part of some of the phases that are to come. So here's an illustration of the bikeway system and a map and the different phasing that's going to come along. Let's see. And with that, all of the on-street infrastructure is funded at this point. And then also, obviously, it integrates some of the trails and park systems. And there's still some of the trails like on the along the river that are yet to come that are obviously pretty exciting potential developments that we're looking forward to. Next, here's an example of one of the on-road infrastructure improvements from the Bikeways Plan. This is a Sharrow. A Sharrow is like a shared lane in which a bicycle as well as other street traffic, they share that lane. The pavement marking there indicates where a bicyclist is expected to ride the lane placement. But as it says over here, this is over by 29th and Farallon by the Advisors Excel building. And then here's some of the signage I mentioned earlier that started in 2014 that goes at the top of the sign and it indicates that you're on a bike route. It's nice because for folks who are newer to riding, which is probably the demographic that we're trying to appeal to, is all the potential folks out there that haven't felt comfortable in the past riding. That it shows them that they're on a road that's probably a recommended road or based on design and all that sort of stuff. It's a little safer for bicyclists to ride on. So then, recently, the Bikeways Committee has worked with the City of Topeka in creating some educational materials to go along with this Bikeways Master Plan, and that includes a 3-minute video that we've done so far. It's going to be part of a series of videos that we're going to put out to try to help inform the public on safe ways to ride and just different aspects of riding that make it a little more approachable for that demographic I was speaking of earlier. And that was done, like I said, as a partnership. it featured people who ride in Topeka, individuals, community members, and it was a partnership of the City 4 group as well as Bikeways committee members who kind of came up with the content and developed what we thought we needed to share with our fellow Topekans and people in the Shawnee County. And then I'm a part of the Topeka Community Cycle Project organization, and we've been active in Topeka for 5 years. We offer an opportunity for folks, anyone in the community, to earn a bicycle if they want it for recreation, transportation, whatever their needs are. We're happy to help facilitate a bicycle for them. Just recently, we've got 2 league certified instructors with the League of American Bicyclists, so we can offer safe riding courses to individuals who are interested in learning how to ride Topeka streets and Shawnee County's roads in a safe manner. Then we've also, for the last couple of years, been working on a bike rack program in which we work with other community entities, businesses. We've worked at different businesses and organizations around town in getting bike racks so that not only do we have the infrastructure for people to ride to get to the location, but then you have somewhere safe for them to walk their bike up and kind of give the full cycle of the transportation on a bike. And then I'll also mention one other thing. We've been working with the County Parks and Rec on getting Topeka's second public bike workstation, so you can work on a bike if you've got a flat or something needs adjusted. We've been working with Parks and Rec, and we're getting that's been installed over at at Crestview Community Center. So that's been pretty exciting. So then there's a program with Workwell Shawnee County called Bike for Discounts, and basically it's just an incentive for folks to ride. A lot of trips from a person's home, within 2 miles or so, could be done by bike, and it doesn't have to be every trip you take, but just the fun ones. Let's say you have to run to the store, or you want to go out to eat or something. So this is meant to kind of help incentivize folks to consider riding for those trips. And this just describes that it's a partnership, obviously, and that the way folks, there's different businesses that are partners in this, and they'll offer specific discounts, and then the individual can show them a helmet, and they will get that discount, whether it's a free drink or a certain percentage off on their purchase. And then, do you want to comment?
Okay, so I don't know if you're seeing a trend so far, but a lot of this stuff is active transportation that is moving from one place to another using a physical presence, something that requires you to use physical activity, which again integrates into the health of our community. Having access to easy options for active transportation gives our community a better shot at being healthier. Oh, here we go, the Topeka Metro bikes. So I'm sure you guys have seen the 100 red bikes all around here. They're taking off like wildfire. No pun intended, they are red. So the community members are so far loving the bikes. They're all over the place. You'll see people, general people who had no idea that the Metro was tied to the bikes. They're like, oh, the Metro's doing the bikes. Those bikes are so cool. And they're people of all ages. So I've seen very older people on the bikes, and as well as young people. So it's being utilized in a variety of different ways. Here's just a little graphic. One thing I will say about the bikes is that it's very user-friendly. It's extremely user-friendly. It's all of the instructions to ride are very clear. Getting on and off is clear. And on top of that, if you have any questions, there's all sorts of signage, and there's an app on your phone. So say I want to go down and ride at the Lake Shawnee, and I want to make sure that I have a bike. I can reserve a bike on my phone to make sure that when I get over there, I'll have a bike to ride because it's kind of a popular destination. Okay, so here's our plug about the bikes being really utilized. I can't tell you that the support, especially in the millennials, having this sort of cool quality of life improvement has really been a boost. And on top of that, I went to the Kansas Health Foundation a couple weeks ago, and I had multiple different people from other communities in Kansas like, oh, you got the bike share program. That is so cool. Come up to me, approach me after I had said I was from Topeka. So it's spreading. The news is spreading, not just in Topeka. Okay, so the Topeka Pedestrian Master Plan is our next agenda. Obviously, everyone's a pedestrian at some point in their life. We can talk about bicyclists and we can tell you all about the awesome things in bicycle world, but the pedestrian is a little more accessible for the normal person. So we've got a pedestrian master plan through the city of Topeka that's getting ready to be reviewed and launched. The pedestrian master planning has been really engaging in the community. There are multiple different, I could go on about the pedestrian master plan, but there are multiple different angles in which they're approaching the master plan, which is really kind of nice. One of the things on this map that I really like is that when they engaged the public, they didn't just say, okay, tell me where all the crappy sidewalks are. They just said, where do you want to walk? Where do you like walking? What's a good destination? Where are there sidewalks that you don't want to walk? So they did it in a way that was really engaging to the community, for pedestrians of all ages, for anyone that's going to be a pedestrian ever, so which is everyone. Okay, so now we have the metro to talk about. We've talked a lot about bikes, we've talked a lot about pedestrians, and this is another aspect to that active transportation. Integrating with the Topeka Metro is a very important part for bicyclists, for pedestrians, for anyone who's taking part in an active transportation. As you can see, our metro buses have bike racks on the front, which is a really progressive thing for a community, and it's really it's engaging for the bicyclists to be able to drive or to ride their bike to work, and then if it's raining, they can put it on the front of the bus and drive home. So you have a multitude of different options instead of just saying, oh, I don't want to bike to work because it's supposed to rain today. So you have that out.
Or if you're coming to the county health board meeting, you don't want to be all sweaty, you can do like I did, and you can hop on the bus at Wanamaker with my bike and then get off down here and ride over and not end up like all nasty.
Because it is really humid, and it is dump the pump day. So here's a couple of examples, poor access that we've had in our community as far as the bus shelters go, accessibility onto the buses, and here's a couple of good examples of access. So as you can see, the ramps are different, the accessibility, there's a bike rack, there's a lot more visual stuff going on here. I think I'll go this way. So last we have the slide that sticks out sort of like a sore thumb with a lot of these texts. There's no big pictures on this, but the idea here is the riverfront. So the integration of the trails on the riverfront levees is going to be a huge success to add to our active transportation network. The idea that it's adding to a quality of life feature that also ties into the integration with our health and integration with our active transportation network. So it's going to be a major success. I'm sure you have heard the updates on the riverfront. It's coming along quite smoothly. We've got a lot of developments coming with our riverfront, and the trails are going to be integrated as the top of the levees. So here we are again. Our last slide is Heartland Healthy Neighborhoods, and like I said, Heartland Healthy Neighborhoods wasn't pictured in all of these because these are our partners that are doing these things. They're your constituents. They're the community that really cares about being able to be healthy and having a multitude of different transportation choices. So that's all I've got. Do you have any questions?
Questions?
Very good.
All right. Commissioner Archer? Yeah,
Sure.
absolutely.
Well, first of all, I'd like to compliment Susan Duffy's leadership in TMTA. It's come a long way, and it's recognized and appreciated. The interesting thing on the bike share is that I've got some golfing buddies that always take a golf cart, and yet they've signed up for the bike program and just sing the praises of it all the time. And I thought, at least you could walk the golf course. But no. So the other thing I wanted to ask you was we've had some tragedy recently in the bicycling community, and I know years ago Jim Ogle had a bicycle incident. The former city attorney had a bicycle incident. He was in a halo for 6 or 8 months. What are we doing with complete streets to improve safety of bicycling in Topeka and Shawnee County?
That's a good question, and I'm going to answer the section that I know best about.
Okay.
The idea with our Complete Streets work group is to create policy change that makes it so that when we plan our roads and our transportation infrastructure, that we think about the possibility of other multimodal users. So currently, many of our streets are really only planned and designed for vehicles, for cars, and it's pretty limiting. So when we as a community, as a culture, start moving towards this culture shift of an alternative transportation, it becomes kind of a dangerous situation. So we've been addressing a multitude of challenges with the Complete Streets policy. Currently, the City of Topeka has a Complete Streets policy, and they do Complete Streets work, great job. They do a Complete Streets overhaul, they review all of the sidewalks in a major project. But we're working towards adopting a policy that would make it mandatory that we think about multimodal use when we're designing our streets and our infrastructure. Do you have anything else to add to that?
I mean, beyond the Heartland Healthy Neighborhood stuff, the classes I spoke of, I mean, that's our goal, is to try to get safe ways to ride within the community out there. And then with the videos that I mentioned are trying to focus on both what bicyclists can do, but also from a motorist perspective, what to expect when the bicyclist is around, to try to educate the public as a whole, and not just, not trying to point our finger at any one particular demographic that's using the road, but kind of how we can all work together because we're all sharing the roadway.
I do have a question for you, Andy. With the project, the bicycle project, if people have bicycles that it may be the kids have outgrown or they just don't use as much for one reason or another, are they able to donate the bicycles for other people?
We take donations every time we're open on Thursdays from 5 to 7 or Saturdays from 10 to 1. And yeah, we'd love to have whatever folks are wanting to part with.
And where's that located?
423 South Kansas.
So just right across the street from the post office.
Correct.
All right. If we still call it the post office, right?
Yeah.
So, very good. Thank you.
Thank you.
Well, this is a point in time that we're going to be able to open up if there's any public comment from folks that are here. I would like to just acknowledge that everything you heard about today was something that was identified through our community health assessment and through our community health improvement planning process. So these are activities that are occurring very successfully, not just with us as a health agency, but with those partners that we have the good fortune to work with, and you can see some of those represented here today. I'm very proud of the work that's gone on in this community, and I look forward to continued advancements of that community health improvement plan, recognizing that things don't happen overnight. They take time, and the health benefits that we expect to see will take some time as well. But that doesn't mean we stop doing that as we look at, for example, the next community health assessment. If it's not showing an improvement in an area, that does not mean that we stop providing the work that we're doing at this point in time. So with that, I would just open it up if anybody has any comments that they want to share.
Any comments, questions?
Okay.
Oh, Dr. Pizzino.
I can't help. I apologize, but I was reflecting and during the last presentation on the fact that a couple of years ago, the idea of even having a Board of Health meeting probably was pretty foreign to all of us, let alone having a Board of Health meeting where we would talk about streets and transportation. And I really want to compliment, speaking of success and celebrating success, this success. And it wouldn't be possible without your presence and your sensitivity to these issues. I want to compliment you as a Board of Health for being willing to meet as a Board of Health and to understand that health is really in all policies that you consider. So I hope that when you wear your other hat of county commissioners, that what you learn here can assist you in making sometimes tough decisions.
Thank you. I think Dr. Hunt.
John Hunter, Heartland Healthy Neighborhoods. Oh, Heartland Healthy Neighborhoods, Heartland Visioning. I was just the first thing out of my mouth was.
There you go.
I just want you to share with you that the partnerships that are going on in this community in dealing with health today is just phenomenal. And many times you hear a report about one area and they talk about how they're integrated with others, but some of the other things that I think are going on are worth talking about for just a sec. For instance, with the bike share program. We have an awareness program. We have cut a commercial with KTWU on the bike share program. It's now running on all of the TV stations, and it's running through September. You had a chance to see it?
Yes.
Yeah, it's very exciting, and that's our way of doing some partnership in all of this to help support that. So some things are very direct. Some of these ancillary types of activities, we wanted to do something to bring recognition to some of the changes with the riverfront and the riverfront park development, working with Shawnee County Parks and Recreation. We came up with one idea that is now expanded to what is called the Fourth Friday activities. We have 4 of them planned throughout the summer. 2 of them are yoga sessions that are going to be opened up to the whole community, and 2 of them are going to be boot camp activities, which are exercise activities. And now we're moving again with Shawnee County Parks and Recreation. We're going to try to do one of those camps just for the young kids, and they're talking about busing them over there. And we're going to get kids out on the levees and in and around that area where that entire parks development is going on. Again, indirect but totally supportive of this whole health initiative and bringing awareness to these. So we're excited to partner with the Shawnee County Health Agency and all of the groups that are associated with it. Heartland Healthy Neighborhoods, we attend all of their meetings. And this type of collaboration that's going on in the city, I've been here since 1975. I've never seen this type of activity going on. And this is really worth celebrating the fullness of it. So thank you.
Thank you, John.
All right, I think we're done unless you all have any other questions for us.
These are very beneficial, though. Let's continue, and we're doing them quarterly, correct?
Yes, we are continuing to do that quarterly. We came a little early this month because of budget hearings starting in July, so.
Good.
Okay, thank you.
Thank you.
Well, I've been to boot camp and yoga class.